Good afternoon, everyone. Thank you so much for joining the OSPF's August webinar. Today, we're going to be talking with the folks from Wood County about their experience as they comply with the state Save Students Act. I'm Stephanie Bucher. I'm the communications director here for the Ohio Suicide Prevention Foundation, and I certainly have the privilege of being with you today to host the presentation. I'm excited to welcome our speakers from the Wood County Educational Service Center. We have Angela Patchen, Hannah Medeiros, and Annie Pillmore. Also joining us today will be Evie Roberts. She is the OSPF Youth Program and Policy Manager. Before we get started with this wonderful presentation, we're going to just take a couple of minutes for some housekeeping details. After our webinar today, you're going to receive a link to a post-webinar survey. And that's an evaluation that will be required if you would like to earn Prevention Continuing Education credit or a certificate of attendance. All certificates are going to be sent out to you within the next 30 days. All right, so let's introduce you to today's speakers. Angela Patchen is the Prevention Education Manager for the Wood County ESC. She has worked in child welfare and youth and mental health for many years before she joined ESC in 2014. She has experience in grant writing, fundraising, program data collection, and evaluation. For the past 10 years, she's worked with Wood County school districts to expand prevention education provided to students beyond the traditional drug and alcohol programs to include suicide, gambling, relationship violence, and personal safety prevention. Hannah Medeiros is a dynamic force in youth prevention, and we're so happy to have her here with us today. She received her bachelor's degree from Bowling Green State University, and she honed her expertise and passion for safeguarding young minds by serving as a prevention specialist at Eastwood Schools. She weaves together her academic knowledge and training with real-world experience to create impactful interventions. Annie Pillmore is a prevention education specialist with the Wood County ESC. She's been there for the past 3 years, providing prevention services to 2 local districts in Wood County, ranging from elementary to high school. Services including drug and alcohol prevention, suicide prevention, dating violence prevention, and mental health. Annie also attended Bowling Green State University, and she has a bachelor's in early childhood education and a master's in reading. Evie Roberts is the Youth Program and Policy Manager for the OSPF, where she supports implementation of 2 House Bill 123 approved programs, Sources of Strength and Be Present Ohio, the Online Experience, or BPOXP. Ladies, we are really excited to have you here today, and we are ready whenever you are.
Thank you. We really appreciate this. We actually did this presentation, the one and only time, live for folks down at the Midwest Suicide Prevention Conference last October. And OSPF was so kind to ask us to recreate it online. So if you joined us early, you might have seen me trying to figure out how to see my screen and my friends' happy faces at the same time. But I think we've got it figured out enough. So we're in-person people, not usually virtual people. But so as I said, and Evie was kind enough to join us to talk about Sources of Strength. We have a school district in our county that has used that, but we've had a little bit of turnover there, and so we don't have a person currently that could speak to it. But just like when we were at the conference in October, Evie jumped in and is going to cover it for us, which we greatly appreciate. So this is the Wood County experience. Hopefully my slides are changing as I hit the buttons. And okay, good. They're nodding for me. Cool. All right. So again, I'm Angela Patchen, LISW, OCPC, the prevention program manager of our program. And these guys, we've all been introduced. I apologize, Evie, I did not add you onto this, I guess. But so the Save Students Act, if you're not familiar with it, I'm going to tell you just enough to be a little bit dangerous, probably. It covered a number of things. House Bill 123 was how we were calling it for quite a while, but it did have a real name. But it required schools to look at their policies, procedures, and practices to make sure that their health education required or was providing this some kind of suicide prevention, violence prevention, and social inclusion. We're going to talk about the suicide prevention and violence prevention pieces of that, and the programs that help meet that. And then social inclusion, there was another list of programs that you could do. It also required or allowed schools, not required, to have violence prevention clubs if they wanted to. They are required to have an anonymous reporting system. This is where like the CSTAG and other threat assessment teams and trainings came from. Their emergency management plans and in-service trainings. They were all of that was wrapped up in that bill. So basically, the new Ohio law as of 23-24 school year was that they had to provide in health education or in another class if they didn't have to take health that year. All grades 6 through 12 had to have at least 1 hour or one standard class period every year of some kind of evidence-based curriculum, and then the state provided a list of those on their website. That they also had to have at least 1 hour or one standard class period of instruction in safety training or violence prevention, and 1 hour or one standard class period of evidence-based instruction in social inclusion. And again, that was a separate list for social inclusion. They were required to use an approved evidence-based program that, like I said, they listed online. We were successful in actually submitting a couple of programs from those that were originally approved by the state. So there is a process for them to look at programs that you think might meet the requirements. They will look at those and the evidence base behind them and that kind of thing. And possibly approve them and add them to that list. And then there is an opt-out option. So parents can opt their kids out. That's something that schools have to send home to the parents. And we did that. We helped some of them write that. Some of them use their own. Again, that just depends on how helpful you want to be with the school. A few of the general challenges, and these guys are talking about like successes and barriers of each of the programs, but a few of the general challenges that we experienced, of course, is time. If anybody works in a school, you know that time is of the essence, right? It's very limited. There's not enough of it. There were a couple of district administrators, again, this was 2 years ago, that kind of said, and what if we don't do it? You know, is anybody checking up on it? I think we're past that now. I think everybody realizes, you know, how important this is, and that it's a very important thing that we're offering. There was also a little bit of hyper focus on that. Well, it only has to be 1 hour or one class period, but again, it said at least that, and it's supposed to be an evidence-based program. And we're not aware really of any programs that are only one time, you know, deal that you go in and talk to kids for one class period, and that's going to be enough to check that box. But there was a lot of, I think, hoping and wishing that, that one standard or 1 hour or one standard class period would be enough to say, yes, we did it. But unfortunately, it usually takes longer than that if you've looked into any of these programs. Also, that first year, there was a little bit of that trying to squeeze it in at the last minute, because at the same time, schools were also presented with like the Aaron's Law, so sexual abuse prevention. And so there were a lot of schools were trying to kind of, if they didn't have a plan for it ahead of time, trying to go, okay, it's March and we got to get this done. How do we get all this done? And, you know, before the end of the school year. And again, originally the law allowed for it to be assigned as a homework assignment or done as an assembly, which we all know is not good suicide prevention. To do that with large groups of students where you can't keep an eye on all the kids, or to have them do it at home where they maybe don't have adult supports around them, is not the safest way to do this. And we did some advocacy here in our county about making sure, you know, that schools understood that. We try not to even do these things on like Fridays necessarily, you know, or at the end of the day, like the last class period of the day, where then we're just sending them home and we don't know if they have the appropriate supports at home to, you know, talk to if this brings up feelings that they need to express to somebody. So that is the general overview, and I will now pass it on to Hannah, I believe. Oh, Annie.
It's me. So I'm Annie Pillmore. I am the prevention specialist at two schools here in Wood County, one being Elmwood and the other being North Baltimore. Both are pretty relatively small schools, but I am kind of split my time 3 days a week at one and 2 days a week at the other. And I'm going to be talking about two programs, both of them that I have currently used at both schools. The first one I'm going to be talking about is called Lifelines, and it's through Hazelden Publishing. So Angie, if you could switch that, perfect. So just some overview. This one is relevant for grades 5 through 12. So it does meet that whole grade level band that we need to meet of obviously 6 through 12. They even have a section obviously for 5th grade, even though they're not mandated by law to have it. Still good information for them to have. With Lifelines, I like how the curriculum is broken down a little bit. So they do have a set curriculum for grades 5 and 6, and then another curriculum for 7th through 10th grade, and then another one for 11th and 12th graders. So you just, depending on what grade you are teaching it in, you just find your piece of that curriculum within the book. I like Lifelines just because it does have a variety of videos that the students watch. They have handouts, there's some group activities, and then each lesson also has some resource cards, which I'll talk about in a little bit. They do need a little bit of updating, so I've kind of managed that on my own a little bit, but I do like that they have resource cards that can be given out to each student. So 5th and 6th grade and the 7th through 10th is pretty much the same in terms of how the programming is broken down. They both have 4 lessons that the curriculum consists of, and they're about 45 minutes each, which does fit in with that standard class period. I know some classes are about 43 minutes, maybe a little bit longer, so I think pretty doable to do in that standard class period of whatever you are given at your district. 11th and 12th runs a little differently as they are only 2 lessons, so I have usually no problem getting into doing these. Again, 45 minutes each lesson, so again, can be fit into that class period time that you are given. I will say with this one, the first lesson in the 11th and 12th grade bracket is a lot shorter for some odd reason, so I always get done really early with that one. So either I just go on to lesson 2, or I have found kind of an alternate activity that I've worked with the teacher to kind of develop to kind of fill some of that time gap that we're given. So that's kind of how it's structured. I'm not going to obviously read these learning objectives to you as there's a lot here on the screen, but it does kind of transition as you're going up the grade levels. Really at the 5th and 6th grade level, they're just learning some basic information about suicide and kind of learning how sometimes we have some unrealistic or unhelpful problem solving that we tend to do. And then they really focus again on reasons not to keep suicide a secret. And that kind of carries over into that 7th and 10th or 7th through 10th grade bracket as well. Where now in this bracket, they are learning how to identify specific warning signs of suicide in themselves or in their peers. And they've broken it down with a really nice acronym, which is FACTS. It's, they're learning the warning signs within feelings, actions, changes, threats, and situations. So it's kind of a nice little way for them to kind of organize what those warning signs would be. They learn an intervention or an action step plan to help somebody, and we really do talk about trusted adults. That is something that I have found really does carry through all the way with these, and just something that I find really important when talking with the students is identifying who their trusted adults are. 11th and 12th grade, I actually find the most fun to teach, I think, personally, just because it really does focus on life after high school, life after graduation, and how sometimes we have these assumptions, we have these thoughts about this is what my life is going to be like. I cannot wait to go off and do all these things and make a lot of money or go to college or, have my dream job. But sometimes those expectations, assumptions don't always become reality. And then with that, sometimes that really sends people in those negative slumps or like that poor mental health. So it really teaches them how to kind of come out of that or realize that we may be in that mindset. And then kind of assess what the support system looks like after you graduate, as most of these kids have obviously been in the same school district. Teachers, administrators are all the same for a number of years. And so looking at outside what exists for them, what resources exist for them. So I kind of like that. I love to do that with the seniors just because I feel like it's most relevant as they are literally about to walk out the door and graduate. So I always like to do this one in the spring just because it's real life. It's coming, in a matter of weeks. So I always like to do that one for 12th grade. All right, so some barriers that I have seen with Lifelines. So it is a little bit it's not outdated, it's more so outdated in the sense that they have not updated with the new Lifeline or the new hotline number 988. So those resource cards that I mentioned prior, I have kind of reformatted or restructured, kind of just made my own to give the students because they do, the ones that come with the curriculum do have the 1-800 number that obviously no longer exists. So it's not updated to the 988 number, but that can easily be, a fix. The upper grades, so they do have that 7 to 10 grade or 7 through 10th section. And I would say it's really not well suited for 9th and 10th graders. I personally like to do the 7 through 10 for about 8th grade. I feel like that would probably be the cap. They do watch some videos in that section, and I feel like if I showed that to 10th grade, they'd be like, why are you showing me this? Like, it just is not very relevant to them. I still think information is good, but they focus too much on the wrong thing. They focus on the actors or, what is happening in the storyline in that video, and they're not really focusing on what's being, taught to them. So I would say the 7th through 10th section is definitely more appropriate towards like 7th and 8th graders. And then with that, it is repetitive. So because this law requires us to teach suicide prevention every year from grades 6 through 12, I could not reteach Lifelines every year, especially in that 7th, 8th, 9th, 10th, because it's the same lessons. It would be the same 4 lessons. So being repetitive and being that such a big bracket would not be necessarily super helpful in this. So then you'd have to find a supplemental curriculum, which we have other ones. So that is helpful for you. Hopefully, maybe that's why you were here to learn some other options. Um, but that is a big fallback, I would say, when using Lifelines, is that obviously you could not use it year after year. Cost-wise, it's not a super high cost to purchase the curriculum. It's not free though, like some of the other curriculums we're going to talk about. You can receive training. We couldn't find an exact cost for our training. We did have a trainer come in to us at our office and train us all at once, but that can obviously add up no matter how many of the participants you have. The total cost though for just the curriculum itself is about $300, a little less than $300. So depending on what your budget is, that can obviously be a barrier to you and your district or your organization. But successes, I would say there's probably more successes than anything, just because the program is really good. I definitely really like teaching this one. The program itself within the curriculum, before the curriculum starts, there is some resources and whatnot for your district. So if you had to go in and present this to your district and say, obviously, this is a school requirement, and they're kind of hesitant, you can really present it in a way that asks about their readiness. So there is a questionnaire for administration about what practices they have currently in place, about 50 questions or so that ask about like if they have crisis response teams in place already, what the strategies would look like, how to handle or how to alert the community, the families about a crisis situation, or maybe if there was a suicide in your school, how to alert the rest of the families of the school to that situation. So it kind of just gauges their readiness to see, are we ready to attack something like this, and what is our plan should or if something like this happens. They also provide staff training within that beginning of the curriculum as well. So it basically teaches students, or it teaches staff how to identify potential at-risk students, what their particular role in suicide prevention is, because as we've learned, I mean, suicide prevention is everybody's role. Everybody has a role in that. So it kind of talks about what their particular role would be, and establish if they personally want to be considered a trusted adult. Hopefully, all adults in our districts want to be considered trusted adults. However, this curriculum does provide like a little sticker or something that they can put on their door that says, "Hi, I'm a trusted adult." So that way, students can recognize, oh, this would be a safe person to go. They would know how to respond, or they'd be someone I could talk to should I, be in a crisis situation or, really struggling. Additionally, they also have a family component at the beginning. It does come with a parent workshop on how to work with their children, how to talk to them about suicide, how to talk to them about mental health, and just sharing with families why teaching this type of program is important in schools, because we do have some families that are like, well, if you teach this, if you talk about suicide, then my student's going to think about it and then, have thoughts about, taking their life. And really that we've learned that's not the case. So it kind of opens up that conversation with families about why this is important and why we have to do it. And then overall, in this curriculum in Lifelines, I would say the engagement is pretty on top of it. They have engaging activities. The 5th and 6th grade curriculum has a riddle that the students really, really love. They always are like, I'll say the riddle, they solve it, and they're like, oh, can you please tell us another one? And I'm like, I can't think of one off the top of my head like that. Like, that's impossible. But they really want you to. So then sometimes I have to come up with another riddle just for fun. And then there's, like I said, videos, there's some worksheets, some group things, role plays that they do, just to really make it a fully comprehensive program. So overall, Lifelines would be a really successful program to use. And then I get the pleasure of also talking about another program. I would say I use Lifelines more often, but then Erika's Lighthouse really was fully developed. It's been updated, so this is also equally amazing. And then I use this kind of in those off years. So as I had mentioned with Lifelines, that is a big bracket of grade levels that I obviously can't teach every year. So I end up switching to Erika's Lighthouse, which is an amazing program. So what is, I think, most amazing is everything that you are getting is completely free, which is incredible once you actually go onto the website and you look at all what's offered. To have this all available for free is incredible. This is for grade levels 4 through 12. So again, there's a couple grade levels we are not required to hit, but they do have information. And I would say it's never too early to talk about mental health, and that's super grade level appropriate. They have 4 pillars throughout their program that they use. So we have classroom education, which is what we are mostly talking about today. It's all the classes that we would teach. They have empowerment clubs, which are just peer-led groups. I don't specifically have like an Erika's Lighthouse peer-led group, but I have some other peer-led groups that I do run, and then I usually take some of these activities and implement them into our district or our culture. So it's just really some activities or some posters to promote overall wellness or good mental health. There's instructions for how to make DIY stress balls, or there's an random acts of kindness chain, sorry. Or they have lunch table education materials where you can print off a bunch of stuff, have a table at lunch, and just promote, again, good mental health, good wellness. So I really like the empowerment clubs and all their activities that they provide. They have family engagement, providing just potential family trainings. They have workbooks available, activities to do at home, again, how to talk to your child about mental health and suicide. And then they also have information for staff. Again, kind of the same thing that Lifelines had. They can do individual or group training. It's pretty much all done self-paced online. Again, materials and wellness for their staff, like for staff well-being as well, because when we're working in schools in general or working with kids who are struggling, it can obviously take a toll on us. And so there's a lot of materials and resources out there for staff. So all of that completely free. On their website, all you have to do is go onto their portal and make an account. So this is the breakdown for grades 4 through 6. Erika's Lighthouse is also broken down into 4 lessons. Again, a standard class period. They have the objectives here for you. And then most of these also provide students with an exit ticket or some type of self-referral card where they can write down how they are feeling after your lesson, if they want further follow-up, either from yourself or maybe from a school counselor, just so we can check in and obviously make sure that they are understanding, but also taking care of themselves the best that they can. This 4 through 6 bracket is really more about just overall mental health, to understand that we all have mental health, what our feelings and how they're tied to that. Really talking about managing stress and focusing on how to help peers and how to help friends. 5 through 9, they're really focusing again more on raising awareness about depression. It's kind of a depression awareness lesson. The videos within these, I would say, are really strong. The kids really understand. They're at a good level for them to understand. I think I've taught this one in about 7th grade and felt really good about that level that I have chosen. Again, standard class period here, self-referral cards. Even if it says it's not available or it's not provided, I usually have my students fill out one anyways for each lesson, again, just to gauge, make sure that they are good, taking care of themselves and checking in with whoever they need to. And then 8 through 12, Same format again, 4 lessons, raising awareness about depression, suicide, help-seeking type behaviors, focusing on increasing students' empathy, because I really think that that needs to be hit home. Obviously, we have to understand what it might be like for somebody else. Maybe it's not affecting us, but we have to kind of put ourselves in other people's shoes to understand what they are going through. And again, focusing on that network of support, who we can turn to, who we have in our circle when we are struggling, when we're going through those difficult times. So, some barriers to Erika's Lighthouse that we have found after using this for a couple of years. Actually, the first is no longer a barrier. 988 has been included. At the time of this slideshow, it had not been included, but they had done a complete overhaul of this website, of the curriculums. They redid a lot of things, they redid the videos, and they have now included 988. So that is no longer a barrier. So that's great for us. Kind of a barrier and also maybe a positive depending on how you look at it. With Erika's Lighthouse, like I said, there are 4 lessons, but really that 4th lesson is technically not needed, as it's usually done as just a review, or sometimes it's a follow-up slash like a presentation of some kind. So you really don't need it for like that evidence-based practice, because there's no new content in that 4th lesson. It's really just a review, and actually it doesn't even take 45 minutes. Like when you look at that page, it's one sheet, or there's no script. I mean, there's really nothing there. So maybe that's a barrier, because there's no new content, but then also maybe it's helpful because, again, Angie talked about time. Time is such a factor. And so instead of saying I need 4 lessons, you're like, I only need 3 times to, come into your classroom, for instance. So depending on how you look at it, could be barrier, could be success. And then the other thing with doing those older grade levels or those older brackets, obviously, I would say that those older students would need some type of previous knowledge around mental health, because if you're just jumping in and talking about depression, they may not make the connection that depression relates obviously back to mental health. So I would say that they need some type of previous knowledge about that before you're jumping in. However, that might already be covered in a health class, or maybe someone else is already talking about that. So I would just say, know your audience, know what they've already been exposed to, so that way you are, picking something that would be relevant. And then successes. So, it's free again, which is incredible. The amount of stuff and the resources, the quality that you are getting for free is absolutely insane when you look at it. So it's really incredible. So free, complete online resource for you. I personally have not had to contact their customer service, but a colleague of ours had to, and they said it was very easy to talk to somebody and get a hold of somebody from the company. And if we've ever worked with any company, sometimes that can be a nightmare to get a hold of the person and get the answers that you want. So Erika's Lighthouse is very good about making sure that you have what you need, and getting back to you in a timely manner. I would say this is a really good mix of all the programs that we are mentioning today. Again, it's kind of that nice filler between in those gap years when you can't teach something else. It really does build on that same information, which we know, because if we're teaching this every single year, that information can obviously get repetitive, but you're finding new ways to talk about it. You're finding different videos for them to watch. So it's not just the same thing every single time. Giving them that basics, those things that they need to know, but still making it engaging enough. And then very, very simplified, very easy to use. Everything is already done for you. So personally, when I use Lifelines, I tend to make my own slideshow to go with it, because my kids are visual learners. I like to have something up on the slides or on the screen for them to watch as I'm going through things. With Erika's Lighthouse, everything is done for you. It's either done in Google Slides, or when you're in the website, you can either choose Google Slides or a PowerPoint version. The scripts are all there. The student workbooks are all there. So everything is completed and done for you. So you don't ever have to reinvent the wheel, which is amazing. The other thing I really liked, sorry, it's not on there. The other thing I really liked about Erika's Lighthouse is all of the materials, including the family materials, the family workbooks, all of the student workbooks. It's all also available in Spanish. So they have Spanish materials available on their website as well, which is helpful for me. I do have some English language learners at my school, and so I would always be able to make sure it's relevant to them and they're able to follow along and still participate. So not on here as a success, but I definitely wanted to make note that that is available for you as well. So those are the two that I mostly use in my schools.
Thank you so much, Annie. And now we will turn it over to our honorary ESC member for the day, Evie Roberts.
Much appreciated. Thank you so much. Yeah, I'm excited to talk about sources of strength. Their vision is to empower a well world. Next slide, please. Perfect. So starting off, what is sources of strength? Well, the secondary program is an evidence-based mental health, wellness, and suicide prevention program that has also been shown to reduce violence, bullying, and substance misuse. Within the last few years, they came out with additional curricula, so now can be implemented in any grades K through 12. However, the elementary program is still evidence-informed. It's not yet evidence-based. So we are going to focus most of our time today on the secondary program, but just a couple of points about elementary is that it's focused on socio-emotional learning with curricula for each grade. So that allows it to introduce things that are really helpful for suicide prevention, but keep it developmentally appropriate. So it's a lot of like identifying our emotions and talking about how do we reach out for help whenever we're engaging with those younger grades, with optional grades once you get to 3rd through 6th grade to actually have a suicide specific lesson. The lesson frequency, lots of flexible options, but usually it's taught once or twice a week throughout the entire school year. And then they also include activities and norms that are meant for daily classroom management. So sometimes folks will kind of look at the elementary program as an opportunity to do some planning, maybe eat some lunch, but we really want a teacher who is maybe not teaching the sources of strength curricula, but is in fact allowing for somebody else to push in and provide those lessons, to really be involved so that way they can reap the most benefits by integrating those additional activities and norms into the way that they engage with their students. There's also a coaching component that supports program coordination and also focuses on staff wellness, because we know that it's a lot easier to teach these kinds of concepts whenever we know how to do them ourselves. After all, you don't want me to ever be teaching trigonometry because I don't understand myself, and hopefully somebody is only teaching sources of strength if they are familiar with that program. At the 7th through 12th level, we've got the youth-led prevention model, and it builds protective factors at the population level that are associated with suicide prevention, but we'll delve more into that in the next couple of slides. All of the sources of strength protective factors are named for those protective factors that are listed on this sources of strength wheel. On the left-hand side, you see the original wheel. On the right, you see the one that they've been using for the elementary program. So just touching on those very, very briefly, you see that we've got people, we've got activities, we've got different forms of health and connection. So mentors, for example, that's essentially where we find our trusted adults, because we know that whenever young people can identify at least one trusted adult outside of the family, their likelihood of dying by suicide decreases significantly. We also have things like spirituality. And so that could be involvement in a faith community. Certainly, that's where a lot of people first go. But spirituality is really more focused on those things that make us feel connected to the people, places, and things around us. So it's really important for us to help young people identify a sense of spirituality, even if it is not tied to a faith system, or to expand their connection with spirituality beyond merely going to church on Sundays or hanging out with friends from youth group. So is it nature spirituality? Is it feeling connected to people, at music concerts or those other kinds of opportunities? And then also things like physical health. So 40 or 50 years ago, we didn't realize that we could be so stressed that we could cause heart attacks, or that we could just be having a panic attack and that our heart is actually not in danger. So having those kinds of opportunities to teach young people at a much younger age that some of these physical ailments that we're having could actually be related to our mental health and therefore require mental health intervention is really important for them being able to reduce the likelihood of suicide later, because they already have so many incredible emotion regulation skills. Next slide, please. At the elementary level, it starts off with those coaches that engage instructors and other staff around wellness. There's also the classroom curricula that can be taught in any grades K through 6. And then in addition to just the regular lessons, it's thinking about those different activities that are supposed to transform the culture itself. Eventually, the culture is supposed to change such that health is not just a choice that we make, it's actually the norm in the way that most people engage within the school. And that's followed up pretty well at the secondary level as well, if you wouldn't mind advancing. So here we've got a team of adult advisors working together with peer leaders, and they develop these strategic prevention campaigns that are also supposed to create cultural change, but we'll break those down one by one. So for our adult advisors, they're supposed to be caring, connected, and positive. That means that they don't have to be clinical mental health staff. After all, we know that a lot of times they have really high caseloads, and that mental health should be the responsibility of the entire school culture and population. So we really look for those adults that are connected to other young people, and then work with them to identify students who are really influential within their groups. Because we know that the captain of the football team is going to have more influence with the rest of the football players than the person who started their own garage band. But the person who started their own garage band, their fellow instrumentalists are not probably going to care much about what that football captain has to say. So we get all of these young people together, and then they do a series of themed prevention activities that are tied into different strategic campaigns, things like raising awareness about the strengths, or trying to get people to drink more water, or trying to normalize the idea of having a trusted adult. And then again, we have that kind of positive culture change, so such that wellness becomes the norm within the school. Next slide, please. Sources has a bunch of templated campaigns, so that way people don't have to start from scratch. They can start with these campaigns that other young people have developed and have been refined in other parts of the United States. And they've got lots of things that people can either purchase from the website or that they can recreate in a DIY method. So that way it just makes it a lot easier for them to get going with their first activities. Next slide. And there are lots of different modalities to engage folks. So there could be a classroom integration piece, presentations, lots of murals, lots of all school activities like graduation or a pep rally or football game, even thinking about how do we tie this in with morning announcements or the school social media. Next slide. And of course, Sources is approved to help schools reach compliance with House Bill 123, and they've even got 4 templated campaigns that schools can use to help them reach the content and requirements that are on the screen. And there are other strategies to reach compliance with some of those other requirements. Go ahead. Thank you very much. Some of the barriers, so sources can be really expensive. Thankfully, all of the costs have for the training and for the licensing fees have been paid by Sources of Strength Ohio, which we lead since 2020. So if we were not able to provide that funding support, then Sources would be too expensive for most of our schools to be able to implement. It's usually $6,000 for startup costs and then annual fees of $750. So just trying to make sure that we are keeping everything in our state so that we've got enough trainers and we've got enough funding for licensing fees is a huge part of what I do at the state level. And then for House Bill 123, it's only approved for secondary, so you can't implement the elementary program for 6th graders and then be compliant with it. You do have to get those 6th graders wrapped into the 7th grade program or the 8th grade program. And you can actually implement Sources of Strength to fidelity without fulfilling House Bill 123. So there's just a couple of different things that people have to think about. You know, how are they going to reach all of those students for one hour? How are they going to make sure that they get all of the students? Maybe the middle school and high school encompasses 7th through 12th, and so they have to be really creative about how do they get the 6th graders represented. And then those upfront time requirements also, it's 3.5 hours as a minimum training requirement for the adult advisor training, and then a minimum of 4 or 4.5 hours for peer leader trainings. So trying to find, you know, subs for 1 to 2 days can sometimes be a little bit tough. So it really requires a lot of buy-in amongst the staff to get them to feel like this is really well worth it. Next slide, please. However, despite this, Sources is a pretty popular program in Ohio. There are about 420 schools that have used the program, including 232-ish programs that have used the secondary program. Many of the materials in elementary and secondary are available in Spanish, and there is an incredible level of peer-reviewed evidence demonstrating the impact of Sources, including one from late last year that found that Sources was able to reduce suicide attempts by 29% whenever it was implemented to fidelity. They also found that even though Sources of Strength is a tier 1 program or a universal program, that Sources had the most benefits with peer leaders who had the least healthy coping skills and then students who had prior suicide attempts. So oftentimes we find that those students are not appropriate for the kind of general prevention education or trainings that we would want to make available to them. And we have to have different levels of programming for each. But to find that not only is it effective with those students, but it's also appropriate for the rest of the population means that you get to implement one program instead of 2 or 3 to be able to cover that entire student population. And then, as I mentioned, we've been covering the trainings and then licensing costs for the last 4 to 5 years. Thank you. And we're reaching 183,000 students across the state of Ohio. So it's been really wonderful watching Sources of Strength spread. I think we're only in the Bowling Green Middle School and High School in Wood County, but hopefully there'll be some additional opportunities to expand later on this school year. And then next slide. And then I'm done. Thank you very much.
Thank you, Evie. We appreciate you very much. And now Hannah.
Hi, my name is Hannah Medeiros. Like they said, like forever ago. I am in Wood County at one school district. I have been there for 11 years, and today I am going to be talking about teen mental health first aid, which is through the National Council of Mental Wellbeing and the Born This Way Foundation. So originally, the teen mental health first aid was actually only supposed to be provided 10th grade to 12th grade, but then obviously they learned that a great opportunity for the kids to actually get the program is through health education. So just, I think 2 years ago, last year or some point, they changed it as to where grades 9 through 12th graders can do it. I teach it in sophomore class, and I've also taught it as a junior class. Slide, please. Okay, so the learning objectives. So obviously I'm not going to read every single one. The big thing about the program is they want students to be able to recognize warning signs in both challenges and crisis. So they learn this action plan. So it's look for warning signs, ask how they are doing, listen to them, help them connect them with an adult, and really show that your friendship is important. So they really work on those 5 steps through the action plan. We really do emphasize on, okay, now that you've noticed that your friends aren't doing well, what a trusted adult can you go to? And literally one thing we say all the time in this lesson is like to really like hit on we're not teaching teens how to diagnose. We say it almost every session that you teach it in. But yes, we do say that. Go ahead, slide, please. All right, so it is an evidence-based program. Researchers from Johns Hopkins University Bloomberg School of Public Health conducted the original evaluation. So the initial pilot was only 8 school districts, and then they did an expanded pilot with 35 sites. My school district was actually one of those 35 sites to actually be involved in the expanded pilot. Yeah, it was pretty cool to experience. At that time, I was doing it with the junior class. So what they were really looking for was, okay, do they take the knowledge of general warning signs? Are they able to use that action plan with their skills, with their friends? So in all total 54 sites, doing the math in my head here, they reached about 2,580 students altogether. And the biggest things that they noticed is that originally, only about 45% of those students were comfortable asking their friends if they were thinking about suicide. So in the pre-test, they were saying 45%. And in the post-test, it went all the way up to 75%. And then 73% in the beginning were saying that they were avoiding conversations about suicide because they were afraid that it was going to put the idea in their friend's head. Well, that lowered in the post-test to about 36%. And then at the beginning, they felt confident to help a friend in need. About 59% said they were. And then by the end, about 94% said they were more confident in helping their friends. And then obviously through the research, they were also looking at the instructors. What did you think about it? 98% of instructors said they felt as if it was relevant for their teens, that it had a positive impact, and they had over about 500, I think, referrals to community services after doing the program through the expanded pilot. So obviously I've been great. So the structure, you have 2 options, 3 options really. Either doing it in 6 45-minute in-person sessions, which is what I do in my schools, or if you maybe have like a block scheduling, you can do the 3 90-minute sessions. And then recently, like probably a little bit after COVID, they created the blended lessons. So 6 lessons consisted of self-paced online lessons. Then you would do like a live instructor-led sessions. So I think it was like 2 hours of self-paced work that they had to do. And then you would have to do a live in-person or instructor-led session. So barriers. So very expensive. Each manual itself that you have to get for the students are about, and I haven't looked recently, $13 with inflation. It might be a lot higher. to get independent training and stuff like that, it was pretty expensive. You know, you have options of getting a whole school district trained, which is like 16 instructors or an organization. I mean, altogether it was like $52,000 if you did that route. So it is a cost. You have to buy manuals for every student to have. So that alone can get pretty expensive. Another thing is, and it's actually have changed. Originally, it was about 10% of the staff had to be trained in what's called youth mental health first aid. They wanted to make sure that staff that was in the schools knew what to do when these students were getting trained in the teen version. Now it's only 5%. They definitely lowered it due to the financial burden, but they're definitely still encouraging that 10% of your staff have to be trained in youth mental health first aid. The length, obviously, you can't do non-consecutive days. I do it once a week at my school. Don't do Fridays. But and they say no longer than 2 weeks in between your sessions. And repetition. So actually, when I was talking to my students about this, like during the expanded pilot, I would ask like, okay, like, what do you think are some of the barriers? And the students actually said that if they felt as at some points it was getting very repetitive when you learn the action plan, because you learn how to do the action plan with just mental health challenges. And then you would often learn that action plan with suicide and crisis situations. So they felt like they were kind of hearing the same thing between, I think it's lesson 4 and lesson 5. So those are some of the barriers that they see. Another one that's not on here, everything is like in a portal. It's called the Connect, and it can be very glitchy. Sometimes you can't get in. How to find things is very challenging. We were at a conference, a National Council Conference, and they were saying like, we know we're trying to work on it. So they are trying to make that portal a lot easier to use. But right now it's still got some work to do. So that was definitely another barrier.
Hannah, I'm going to jump in
Yeah.
real quick. So we, you know, if anybody's sitting out there going, wow, how'd they get the money to do this? We've been able to partner with some other local organizations that had a grant. Like for the last person that we sent through instructor training, there was a local grant through our university had, and they were able to pay for an instructor to go through the training. Yeah, like Hannah said, you have to pay for the manuals, but because most of the other programs we're using are free, we just kind of do this in one grade level at a school, so that kind of helps that we're not paying for manuals for multiple grade levels. And again, the youth mental health first aid too, it is a time commitment to get staff in districts trained, but there are a lot of resources out there to get adults trained in youth mental health first aid. So you really shouldn't, and most of the ones I know are not charging anything, like they're offering the training for free. So if anybody's not aware of that, there are places to get youth mental health first aid training, usually at low or no cost.
Perfect. All right. So successes. Obviously, this is probably one of my favorite things to teach. I teach a lot of things at my school district, but I love teen mental health first aid. It's very guided teacher notes. I mean, word for word, what you need to say. The teacher's notes manual is like really thick because they want you to be prepared as possible. And as soon as you can get into the portal, there are a lot of great resources in there, like opt-out forms are already created, how to draft emails and templates and marketing campaigns. So the portal's great as long as you can get into it and know where to go to find all this stuff. This mix of teaching styles. So, you know, teacher-led discussion, there's group work, there's role plays, the videos are good. They've just recently updated them to, you know, you have to change those every once in a while. To fit with, you know, generation stuff like that. So they've done that. They received the book, they received the manual, there's activities to do. So it's a really good mix of just not just me talking up in the front and things like that. It encompasses most topics. So it's not just about crisis scenarios. It's not just talking about suicide the entire time. It also talks about just helping your friends who are going through mental health challenges, which I do enjoy as well. It's appropriate for grades 9 through 12. I don't feel like it's fake or it's forceful. It doesn't downplay any of the topics that you discuss. The students have said that they felt like the examples were appropriate, the videos were appropriate, the scenarios were good. They felt like they could relate to it. So I definitely think it's a good program to use. So I think I have one more slide. Yep, that's all we got, I think. There. I don't know if Angie wants, I don't have.
Okay. Hang on. Let me figure out. I can stop sharing, I believe. Okay, cool. So questions. How did Wood County ESC end up implementing 4 programs to help their schools reach compliance with House Bill 123? Oh, hang on. Would any of you ladies like to tackle that?
Hannah, you're muted.
I was just rereading the question out loud in my
I mean, I think that our staff really kind of took on the idea, as I remember it. I mean, this was 3 years ago, but but we kind of knew this was coming, and so we started looking at the programs that we already used. We asked some other professionals locally and said, hey, what are you guys doing for this kind of for suicide prevention in your area? Because I think it was Donna Dickman from like the Lima area that was the one that had recommended Lifelines. So we purchased a curriculum of the book and just kind of looked at it and evaluated it for what we thought if that was going to work with the kids we work with and that kind of thing. Erika's Lighthouse, I think we just got because it was on the list. Teen mental health first aid was one that we actually worked with the state and got them to approve it by going through a long process of because I think there was some question about the research or the evidence base for it at one point, and they had done the research but it wasn't published yet or something. So once they had published it, then we were able to submit that, and that closed it out. Got them to use it. So it really just depends on the district, on the staff that's leading it. I mean, I'm kind of like, I'm not telling everybody they have to do the same thing, but in each district that they can work with their teachers and their kids and kind of say, this is what we have, and then work with them to choose. Do you guys have any feedback about how your districts chose or anything?
I think that's great. I was going to answer the next question.
Okay.
So Jill asked, for those of you who use a variety of programs, which programs do you recommend using at each grade level? So at my school, we're all different. I think Annie can chime in too with her school. So for 6th grade, I use Lifelines. 7th grade, we actually have a NAMI come in our local organization, come in and do a program with the students. So I don't teach in the 7th grade for suicide. 8th grade, I use Lifelines. My freshman class, I use Erika's Lighthouse. Sophomores, I do teen mental health first aid. Juniors, I do Erika's Lighthouse, and my seniors, I do Lifeline. So that's how I kind of break it up, because like Annie said, that 7 through 10 is hard to use. So we just kind of plug out those 4 programs in and use it that way. But Annie can explain what her school does.
Yeah, that's kind of the same for me too. I mean, I think 6th grade, I have done a couple of things. I've done Lifelines and really liked that. This last year, I did the Erika's Lighthouse, and I thought that that was a good mix, just to kind of switch it up. Since again, I'm at 2 schools, I kind of just play it off and see what works better at each school. So I think at one school I did Lifelines, and then the other school I actually did the Erika's Lighthouse. And really, I didn't have a favorite. Like, I thought both of them would be totally appropriate. And again, since I am split and we have to do this every year, I do try to just kind of alternate as best as I can. In 7th grade, I usually do Erika's Lighthouse. 8th grade, I've done Lifelines. 9th grade, I've actually, no, what did I do in 9th grade? I think 9th grade, I've done some Erika's Lighthouse. Apparently, I think health is usually taught to my sophomores, so I typically don't do this in my 10th graders. I was told that they get in health. I don't know really what they're getting in health and if that actually counts towards the House bill requirements, but that's what they have said that they want. So I am here to serve the school, so that's what I have done. And then I do really like teen mental health first aid as well. So I do that with my juniors, which has gone really well. And then seniors, I do that Lifelines just because they have that senior level life after high school kind of transition. And just like they've put in the chat there, I have also worked with NAMI to do Ending the Silence. And I did that for my freshmen actually this past year. And I thought they did a really great job. NAMI's come out and done just phenomenal with them. thought it was a really good program that they did, and I thought my kids responded pretty well to that too. So you just really have to kind of pick and choose. Some of it's a little trial and error and figuring out what your kids respond to, and maybe you switch it up every year and just see what's kind of sticking and what's working. But it just sounds like we have some good options there and can kind of mix and match to your needs.
I'm going to throw out an additional program that I'm going to tout here. In addition to all these wonderful things that you all have talked about, the Ohio Suicide Prevention Foundation also supports the Be Present Ohio, the online experience, also known as BPO XP, which is also, it has now been approved as an HB 123 approved program. It's supported by OSPF and the Center for Suicide Prevention and Research at Nationwide Children's Hospital, and the funding comes from the Ohio Department of Mental Health and Addiction Services. It is available at no cost. If you're interested in learning more about BPO XP, Evie Roberts is your contact if you would like to contact her, or you can also visit bepresentohio.org/BPOXP. All right. I don't see, do we have any other questions? I think we can probably wrap that up. Ladies, thank you so much. I really appreciate all of the insight that you've been able to impart today about how maybe some school districts can look at ways to comply with the Safe Students Act. Appreciate all of your time and efforts today. Thank you. We're going to be sending out an email to everyone very shortly. It'll include today's slide presentation and an email contact address. A reminder that if you'd like the Prevention Continuing Education credit or certificate of attendance, you do have to fill out the survey that'll be available after this webinar. Thank you all so much for joining today, and I hope you'll join us next month. September 17th, we're going to be doing another webinar, and we're going to be hosting Doug Jackson, who is Ohio's 988 administrator. So we'll be talking about Ohio's 988 Suicide and Crisis Lifeline. So hope you all join us then. Until then, have a wonderful school year. Can't believe that summer is over, but we look forward to talking with you all again. Thank you and take care.